Diabetes and obesity. These two conditions frequently coincide, but they don't get along very well at all. They're not exactly a match made in heaven. I'm Dr. Douglas Street. I'm a medical doctor, and I'm going to talk to you about weighty consequences when obesity and diabetes collide. Now, it has been found that 55 to 60% of type 2 diabetes cases are caused by obesity, and 90% of type 2 diabetics are overweight or obese. So you can see the strong connection between these two conditions. Now we're going to look at obesity and diabetes risk. How does obesity relate to diabetes risk? Now we're going to be using the body mass index as a way to measure obesity. Now the normal body mass index is between 20 to about 25. And of course, I'm sure most of us will know that BMI is a calculation based on your height and weight. There are other ways to assess obesity, but this is the one that we're going to be using today. Only 4.6% of persons with a normal BMI have diabetes. But when you're overweight, meaning that the BMI is between 20 to about 30, then it goes up to 12.3%. And when you go into the obese category, of course, there are three different classes of obesity. So class 1 will be between 30 to about 35, and the prevalence of diabetes in this particular segment of the population is 24.5%, which is almost a quarter of persons who are in this category. And then you have those with class 2 diabetes, where their BMI is between about 35 to about 40, thereabouts. It goes up to 40%. And when it gets over 40, when the BMI goes over 40, which is where you have class 3 obesity, it's 55.6% of those persons have diabetes. So you can see the more the weight goes up, the higher the risk of developing diabetes. So why does obesity cause diabetes? First of all, insulin resistance. When you have excessive body fat, there is associated with that increased insulin resistance. In other words, the insulin doesn't really work as well in those situations. Also, because of the excessive amount of body mass that you're dealing with, it puts some pressure on the pancreas, and then that causes some pancreatic strain, which can reduce the production of insulin in your body. Now, inflammation is oftentimes associated with obesity, and this causes insulin resistance and also pancreatic damage. So these are the ways in which obesity can contribute to development of diabetes. So, but how does diabetes cause obesity? Because I said these two conditions, they contribute to each other. So obesity contributes to diabetes and diabetes contributes to obesity, and they worsen each other when they coexist. Now, because of insulin resistance and impaired glucose regulation, there is increase in your weight because this promotes weight gain. Also, insulin, of course, one of the features of the development of type 2 diabetes is an increased production of insulin because the body is not responding. There's a reduced reaction to the insulin, so therefore more insulin is produced, and insulin puts the body into a fat storing mode, and this causes weight gain. There's also increased inflammation with diabetes. And of course, as we'd have said, inflammation interferes with the regulation of insulin and glucose production, and this can cause weight gain. Some medications that are used to treat diabetes can also cause weight gain, and we'll look at those in more detail a little later in this presentation. Diabetes and obesity have shared risk factors. So as we are all well aware, when you are not physically active, then it can increase the risk of you having both conditions, right? Having an unhealthy diet can also contribute to the development of both of these conditions as well. As you get older, you're more likely to put on weight. And in fact, a lot of persons tend to lose muscle mass and they put on fat instead. And of course, that can cause the development of diabetes. Of course, age is associated with inflammation. The older you get, the more inflammation is in your body, the more likely for you to put on weight and also develop diabetes. Family history can contribute to both conditions. So if you have obesity or diabetes in your family, you're more likely to have it as well. As mentioned before, there are some medications that can cause diabetes and obesity. Now, there are certain antihypertensives that may contribute to development of obesity and diabetes, and these include the beta blockers. And for example, there is atenolol, there's propranolol, carvedilol, and metoprolol. The steroids also may contribute to development of weight gain and diabetes, and these include the corticosteroids and also the anabolic steroids. The corticosteroids include dexamethasone and prednisone, and anabolic steroids include testosterone, which is oftentimes used to gain muscle mass. The antipsychotics is those medications that are used to treat psychoses, for example, schizophrenia. There are the typicals and the atypicals, and both classes tend to contribute to the development of weight gain and also diabetes. So the typical ones include haloperidol and chlorpromazine, and the atypical olanzapine and quetiapine. The antidepressants, one of the more commonly prescribed medications, also contribute to the development of diabetes and obesity. And these include medications like fluoxetine, paroxetine, and sertraline. The tricyclic antidepressants, not so commonly used these days for depression, but they may be used for other conditions. And these also can contribute to weight gain and development of diabetes. Hormonal medications, birth controls. Of course, birth controls are used quite a bit, not just for birth control purposes, but for other reasons. And of course, there's hormonal replacement therapy. These also can contribute to diabetes and obesity. And then there are medications that are used to treat diabetes that can cause obesity. And probably chief among them is insulin. As I mentioned before, insulin puts the body into a fat storage mode, and therefore it can cause weight gain by putting on extra fat. Sulfonylurea also can cause weight gain because they generally increase the production of insulin. And insulin, as we mentioned before, can put the body into a fat storage mode. Medications that fall in this category include glyburide, glipizide, glimepiride, and there are others. So this is one of the challenges with these medications. And I just want to mention something here. Now remember that weight gain can worsen your diabetes. You have two classes of medication here that increase weight gain. So what can happen? These medications can eventually lead to a worsening of your diabetes, even though they are being used to treat diabetes. Because they can cause weight gain, they can actually contribute to the worsening of your diabetes over time. And then you have medications like pioglitazone. These medications, they do increase your body's response to the insulin, but unfortunately, that may have the side effect of weight gain. And it can cause weight gain by more ways than one. It can cause water retention and also increase fat storage. So even though this medication may not worsen your diabetes, as a matter of fact, it can lead to the improvement of diabetes because of how it works. It actually counteracts the effect of insulin resistance. It may cause weight gain. And we're going to look at some of the mechanisms that contribute to the linking of obesity and diabetes. You have the adipokines, and these are hormones that are produced by fat cells, and they help to regulate glucose metabolism. The thing is, when you have this state of this state of diabetes, these hormones their function may be impaired. So this may contribute to the obesity epidemic. And you have what we call lipotoxicity, where you have excessive fat in the liver, which is what we call fatty liver disease. And also you have excessive fat in the muscles. And what has been found is that when you find these things, fatty liver and also excessive fat in the muscles, there is an impairment in the function of insulin. So that can actually contribute to development of obesity. Then you have the gut microbiome, and most of us will know that the gut microbiome is the bacteria that live inside of your gut, and these have been very strongly linked with obesity and also diabetes. Right? So if we find that these bacteria can contribute to both conditions and can actually worsen those conditions as well. What about the effect of obesity on diabetes? Now, first of all, persons who are obese are up to 70% more likely to develop diabetes than those who are not. And for those persons who are diabetic and are obese, they tend to experience worsened blood sugar control. They have an increased risk of complications, which we'll discuss a little later. They have a reduced quality of life, and they have a higher risk of dying. Some of the complications that are caused by diabetes are worsened when you are obese, and these include cardiovascular disease like heart attacks and strokes and so on. And you have kidney disease, kidney failure in particular, blindness, which is caused by damage to the retina by the diabetes, and of course there are other mechanisms through which it happens. Amputations are more likely in a person who is an obese diabetic, and there's greater cognitive decline, and of course this can lead to dementia, especially Alzheimer's disease. Now let us look at the types of obesity and diabetes risk. Now, as we mentioned before, the higher the class of diabetes that you have, is the more likely for you to be diabetic. As a matter of fact, if your BMI goes up by 1, your risk of diabetes goes up by 10 to 20%. And then you have the different types. You have what we call central obesity, where there is excessive amount of fat around the abdominal area. And as we would have mentioned, insulin does contribute to that kind of weight gain. When a man's waist measurement goes above 39 inches or a woman above 34 inches, they have been shown to have an increased risk of developing diabetes. There's also what we call visceral fat. And this is fat around the organs, fat around the intestines, and so on. That type of fat tends to increase the risk of diabetes as well. And this is particularly important because sometimes this type of obesity is not obvious by looking at the person. As a matter of fact, there are some persons who will have this kind of excessive fat collection around the organs that may have a normal BMI, right? And this has been found to be particularly common in Asians, Indians, and Chinese. And so that is why you find that even though their BMI may be normal, they may be at a higher risk for developing diabetes, right? So that is something that persons in that racial group will have to keep in mind. And I'm sure many of us would have heard about the metabolically healthy obese. Some people refer to them as being the fat and fit. Some persons don't like that term, but that's the term that some persons use to describe this category of persons. Even those persons have a 2 to 3 times higher risk of developing diabetes. So there's some real question as to whether this term metabolically healthy obese is really appropriate. And this usually means that their blood test for inflammation is normal, but of course they may still succumb to this condition. So what are some of the recommendations that persons who are obese and diabetic should really consider? First thing, you should really aim for weight loss. And the kind of weight loss that we recommend would be between 5 to 10%. But there are some persons who require more weight loss than that. They may have to go as much as 15%. So let us say, for example, you're diabetic and your ideal body weight should be about 140 pounds, but you're 200 pounds. There are some persons, if you lose as little as 5%, so that means that you bring your weight down to 190 pounds from 200, that sometimes can really turn things around for you where you go into diabetes remission. Some persons may need to lose at 10%, so that means that you bring your weight down by about 20 pounds from 200 pounds to 180. Some may need to lose 15%, which is about 30 pounds, and that may bring the weight down to 170. Of course, this usually very effective in helping persons to go into remission. However, there are some persons who need to lose more weight than that. And I mentioned before about those persons who are of Asian descent, whose BMI might be normal, but they have an excessive amount of visceral fat, excessive fat around the internal organs. And what they've found is that if you're diabetic and your BMI is, let us say, 25, and you have been found, especially if you have been found to have excessive fat on the organs by whatever investigations that have been done, then you should try to get your BMI down to at least 22. And they have found that by doing that, it actually removes the fat from the organs and can actually help that person to go into diabetes remission. So being overweight and having diabetes, it actually can help in a kind of way because you have something to work on, which is weight, which has been found to help to put you into remission. And as we have discussed in our previous video, weight loss is one of the measures that are used to bring a person into diabetes remission. The next thing that you want to do is to look at a healthier eating practice using diets that are healthier. And of course, there are several dietary approaches. There is the plant-based diet, the whole food plant-based diet. There's also the keto diet, which has been shown to help persons who are overweight and also who have diabetes. And that's a very effective way of bringing your weight down and also bring your diabetes into remission. There's also a fasting approach, and there's especially intermittent fasting, which has also been found to be very effective in bringing your weight down and also bring your blood sugar down, and can actually help to bring you into diabetes remission. And of course, there's portion control where, there is restriction in the calories. And of course, a low calorie diet can actually help very well in bringing your weight down and also your sugar down, and can actually promote diabetes remission. Physical activity, and this is another very effective way of keeping inflammation down, keeping your weight down. And it's especially important if you have obesity and also diabetes, or you're on any of those medications that have been shown to promote the worsening of these conditions. You definitely want to make sure that you keep physically active to reduce the chance of you progressing into becoming a worse case of diabetes. As we have discussed in our previous video, stress definitely contributes to the worsening of diabetes and also promotes weight gain. So stress management is another very important intervention to include in your mix of measures to ensure that your diabetes and your obesity do not get worse and actually can improve. And of course, you want to partner with your healthcare provider to ensure that you're properly monitored and supported in getting you to your goal of weight loss and also improvement in your diabetes control. There are some medical interventions which can help persons who are having obesity and diabetes. Of course, there are weight loss medications which may be used. There are diabetes medications that promote weight loss, and these include metformin and semaglutide. And there's bariatric surgery. And these, especially bariatric surgery, it actually can put a person into diabetes remission as well, even before the weight loss has occurred. And bariatric surgery are surgical procedures that can restrict your stomach size, your ability to eat a lot, and these are done to promote weight loss. Some of the benefits of weight loss for diabetic includes improve insulin sensitivity. In other words, the insulin in your body starts to work even better, so the glucose control improves. You may have a reduced need for medications, either in the dosage of medications, the number of medications, and there are some persons who even experience diabetes remission, as you mentioned before. And diabetes remission is a state that you can reach when you control your diabetes without any medications for at least 3 months. That person who has achieved that has achieved diabetes remission. When you lose weight, when you are a diabetic obese person, then there is reduced inflammation inside the body. And of course, inflammation is connected with many different conditions, including hypertension. So you may experience a lowering of your blood pressure. And of course, there are reduced risk of complications because of the reduction in the inflammation. And even other conditions that are caused by inflammation may improve, such as mental health problems and even cancer. So you would experience a significant improvement in your health when you lose weight if you are diabetic and obese. So as we close off the presentation today, just wanted to have a look at 1 Corinthians 9 and verse 25, which says, "And everyone who competes for the prize is temperate in all things. Now they do it to obtain a perishable crown, but we for an imperishable crown." This verse is really talking about persons who are athletes. Athletes, their aim is to go for the gold medal. So persons who are trying to achieve this goal, they are careful about how they take care of themselves. They don't go to excesses. And temperance is really avoiding the negatives and using a moderate amount of even the good things. So we're saying that a person who is going for this kind of prize is temperate in all things. In other words, they avoid bad things and they have moderate amount of the good things, right? Now, what this verse is saying is that those persons are going for a gold medal, which is not something that is really going to last forever. It is a perishable crown, right? And of course, it's not something that is likely to give them eternal life, right? Now, when you have improvement in your health as a goal, then you should also be temperate in all things. In other words, you avoid the negatives and you have moderate amount of the good things, right? Now, when it comes down to trying to achieve weight loss and diabetes remission, you also have to be temperate in all things. Even things that are good, you have to be careful with, because excessive amounts of even good things can cause you to put on weight and have other problems. It can increase inflammation inside your body. So even those persons, they should try to be temperate in all things. But even more importantly than that, now most of us will understand that one of the goals of a Christian is to go to heaven. And when you have that goal, you have to be temperate in all things. There are many of us who go to extremes, even in religious practices. And this can cause a problem, not only for us, but for other persons. What we're saying is that you should be temperate in your practices. When we go to extremes, you normally tend to hurt yourself and you hurt other persons. You want to be temperate in everything that you're doing. Don't overdo anything. And of course, don't do things less than you're supposed to. And when you do that, then it will keep you on the right road and you will achieve the goal that you're looking for. As I said before, I'm Dr. Douglas Street and I have a special interest in diabetes remission. So if you want any more information on diabetes remission, just click the link below in the description or on the chat and you can get more information on diabetes remission. Thank you very much, and I'll see you in the next video.